and welcome. I'm Dr. Naeem. Today's video is about hemorrhoids, also known as piles. We'll discuss what they are, their different types, and I'll also share my personal experience of treating patients effectively without surgery. Part 1. What are hemorrhoids? Hemorrhoids are swollen veins in the rectum and anus. They can cause pain, bleeding, itching, and discomfort. They usually develop due to constipation, prolonged sitting, pregnancy, or straining during bowel movements. Types of hemorrhoids. There are two main types of hemorrhoids. Internal hemorrhoids, these are inside the rectum. They usually cause painless bleeding during stool. Sometimes they prolapse or come out. A third situation is mixed hemorrhoids, when both internal and external are present. Sign and symptoms. Common symptoms include bright red blood during or after stool, anal pain or discomfort, itching and swelling around the anus, and a lump or mass felt outside. My treatment experience. In my practice, I have treated many hemorrhoids patients without surgery, using injection therapy and medicines. Here's one of my typical treatment plans. Injection therapy. Special injections to shrink hemorrhoids effectively. Tablets ciprofloxacin 500 milligrams twice a day to control infection. Tablets Vorin 75 milligrams 3 times a day to reduce inflammation and pain. Ointments, Tronoline and Polyfex P applied 4 to 7 times a day to relieve local pain, swelling, and infection. With this combination, patients usually experience quick relief from pain, bleeding, and swelling. Most importantly, they avoid the need for surgery, which many people fear. Prevention and advice. To prevent recurrence, eat a high-fiber diet, fruits, vegetables, whole grains, drink plenty of water, avoid prolonged sitting on the toilet, exercise regularly to improve bowel movement. Conclusion. So, hemorrhoids are common, but treatable. With proper management, including my non-surgical approach, patients can recover well and live comfortably. If you found
Part 2. Anal fissure. What is anal fissure? An anal fissure is a small tear or cut in the lining of the anus. It causes severe pain, especially during and after passing stool. Although small, it can lead to bleeding and great discomfort. Causes. The most common causes include passing hard stools due to constipation, chronic diarrhea, straining during bowel movements, childbirth in women. Less commonly, conditions like Crohn's disease or infections. Symptoms. Typical symptoms of anal fissure include sharp pain during or after passing stool, bright red bleeding on toilet paper or in the stool, itching or irritation around the anus, a small visible tear or crack near the anal opening. Some patients may develop a small lump called a sentinel pile near the fissure.
Treatment depends on whether the fissure is acute, new, or chronic, lasting more than 6 weeks. Conservative or home treatment. A high-fiber diet and plenty of water. Stool softeners to prevent hard stools. Sitz baths. Sitting in warm water for 10 to 15 minutes several times a day. Pain relief creams or local anesthetic gels. Medications. Topical ointments like nitroglycerin or calcium channel blockers to relax anal muscles and improve healing. Pain relief tablets and anti-inflammatory medicines. Procedures for chronic fissure. Botox injection to relax the anal sphincter. Lateral internal sphincterotomy, LIS, surgery in resistant cases, considered the gold standard for chronic fissure. Prevention. To prevent anal fissures, eat a high-fiber diet, fruits, vegetables, whole
fruits,
grains,
vegetables, whole
drink
grains.
plenty of water,
Drink plenty of
avoid
water.
straining during
Avoid
bowel
straining
movements,
during bowel movements.
treat constipation
Treat
or
constipation
diarrhea
or
early.
diarrhea early.
Regular exercise
to keep bowel
normal.
movements normal.
Anal
In
fissure
summary,
is painful,
anal fissure
but
is
usually
painful,
treatable
usually
with lifestyle
treatable
changes,
with lifestyle
medicines,
changes,
or minor
medicines,
procedures.